We're going to look at taping for an acute lumbar injury. So often a client will come in they've just hurt their back and they want an appointment straight away. So they'll walk in not being able to move, they're in this acute spasm. So manual therapy wise, often we can make them worse if we start to loosen up and destabilize that area. So they're in acute spasm for a reason. It's a protective spasm. So we want to try to see if we can calm that down a little bit, but provide them with some stability or some support to get them moving, get them back in later in the week, and then we can start to apply some more manual therapy techniques. So the way we do this technique is we want to create some stability across that lumbar spine to reduce some movement initially. So usually I would put some two 10cm strips of Fixamol underneath just to anchor that tape. Okay, so now we've got the tape on. When the client goes to move, it does give them a reminder, so it helps to calm that area down. So often the pain is caused by that spasm and locking down that area. So this will give the client some support and some stability. The reason why I do it standing is because if we go to get a client on the table in that acute phase, they're probably not going to be able to get off the table. So I tape them in a comfortable position in the first few days, so that they can start to come out of that position as the spasm decreases. So using anything to get them out of pain, and then encouraging them to move. So what I'd like to do is get them to have a seat and teach them how to correctly stand up, because it is a functional movement and they do need to move around. So that's how I would tape for the lumbar spine to reduce pain and spasm in the acute phase. Nice and slow.
No, like a Band-Aid. Be quick.
Got a couple there.
I feel alive.